Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more important mock questions from the CPC examination. If you are new to the channel, please subscribe and let's look into the questions. First question, the patient presents to the urgent care facility with multiple burns acquired while burning debris in his backyard. After examination, the physician determines the patient had third-degree burns of the left and right posterior thighs, which is 10%. He also has second-degree burns on the anterior portion of the right side of chest wall, 8%, and upper back, 6%. TBSA is 24% with third-degree burns totaling 10%. What ICD-10 CM codes are reported? Okay, so here in this question, as you know, it is burn question. Okay, so the ICD codes will be T codes. For the injury codes, ICD codes will be T codes. And what are the burns and where are the burns that you need to sort it out first. Here the patient is having third-degree burns of left and right posterior thigh. So left thigh and right thigh. He is having third-degree burns on left thigh as well as right thigh. So you have to code for third-degree burn of left thigh, third-degree burn of right thigh. Okay. Then he also has second-degree burns on anterior portion of right side of chest wall and upper back. So it means second-degree burn of chest wall and second-degree burn of upper back. So total of 4 burns you have to code. Right? What all are there? Third-degree burn of left thigh, third-degree burn of right thigh, second-degree burn of right side of chest wall and second-degree burn of upper back. Okay. So total TBSA, total body surface area is 24%. If we can calculate all, 10 plus 8 plus 6, 24% is the TBSA with third-degree burns of 10%. So if there are, for burns, you need to always report the severity first, right? So here the severity is third-degree burn. So you have to always code for the third-degree burn first, then followed by second-degree burn and first-degree burn. Here we don't have first degree, here only third degree and second degree. So you have to code for the third degree burn first. Here, if you can see the options, I will tell you how to skip option, how to eliminate the incorrect options. Since you have to code for third degree burn, if you can check the codes, for third degree burn, the number 3 will come immediately after the decimal point. And for second degree burn, the number 2 will come immediately after the decimal point. So, in which all options are having the number 3 after the decimal point? Like in the first code I'm talking about, because we have to code for the third degree, right? In the first, as the first ICD, you have to always code for the third degree burn, which is there in options B and C. The number 3 is coming, which is coming immediately after the decimal point. It is in options B and C. So our answer will be either option B or C, because you have to code for third degree burn first, which is marked in options B and C only. Option A, it is second degree burn, and option D is also different. So you can directly eliminate those two codes, those two options, or options A and D. Now you can check only options B and C. Also in options B and C, if you check, first 3 codes are same. T24.311A T24.312A, T21.21XA. These three codes are same in both the options. Only the last two codes are different. Okay. So like that you can find out the answer. Anyway, I will tell you each and every code. What is the first one? T24.311. T24.311A, which means burn of third degree of right thigh. You have right thigh and left thigh. So this is right thigh. And what is T24 point? The next option, the next ICD code, T24.312A, burn of third degree of left thigh, initial encounter. Okay, A represents the initial encounter. The alphabet A always represents initial encounter. What is the third ICD? T21.21XA. T21.21XA is burn of second degree of chest wall, initial encounter. X is the placeholder. Okay, placeholder, and A is the initial, A represents initial encounter. So T21.21XA is burn of second degree of chest wall. So these three codes are same in both the options. Now go to the next code in option B, T21.23XA. What is T21.23XA? Burn of second degree of upper back, initial encounter. Yes, these four codes that we need, these four codes are the one which we need to code, right? But what is in option C? The fourth code in option C, T24.231A. T24.231A is burn of second degree of right lower leg, which is incorrect. So we have concluded that our answer will be in option B. So these four codes you have to code initially. Okay. For the third degree burns of left thigh, third degree burn of right thigh, second degree burn of chest wall, and second degree burn of upper back. And then one more code is there, right? That is for coding the total body surface area, TBSA. So what is the last code in option B? T31.21. What is T31.21? Burns involving 20 to 29% of body surface with 10 to 19% third degree burns. Yes, our total body surface is 24% and third degree burn is 10%. So that also you have to code. The TBSA code also you have to code finally. Okay. So that's how you need to code for the burn code. So our correct answer is option B. All the four areas plus the TBSA code you have to code. You have to mark. Okay. So let's move to the second question. This is a 32-year-old female who presents today with sacroiliitis. On the physical exam, there was pain on palpation of the left sacroiliac joint and imaging confirmation was done for the needle positioning. Then 80 mg of dipomedrol and 1 ml of bupivacaine at 0.5% was injected into the left sacroiliac joint with a 22 gauge needle. The patient was able to walk from the exam room without difficulty. Follow-up will be as needed. What is the correct code? So what is the correct CPT code in this procedure? What procedure has been carried out here? The injection, right? Injection. What was injected? Injection of dipomedrol and bupivacaine was injected into the left sacroiliac joint. So we have to code for the injection procedure. Okay. Let's look into the options one by one. What is the first code? 20610. What is 20610? 20610 is arthrocentesis aspiration or injection, major joint or bursa. Arthrocentesis aspiration or injection, major joint. Example, shoulder, hip, knee, subacromial bursa. Here, where was it injected? Left sacroiliac joint. Okay. So, let's go to the other codes also. We will first find out the correct CPT code for the injection. Then we will check if the radiologic interpretation is required or not, because the 7 codes, starting 7 CPT codes is the radiology code. What is 20551? 20551 is injection, single tendon sheath or ligament injection 20551, right? Yeah, injection, single tendon, origin or insertion. Injection of single tendon, it is mentioned. What is 27096? The code 27096, injection procedure for sacroiliac joint, anesthetic or steroid with image guidance, fluoroscopy or CT, including arthrography when performed. Yes, this is what we need, right? 27096. See, that's why I just read out all the codes, the description for all the codes, first 3 codes. Because if you read the first code, the description of the first code, sometimes you will not understand what is mentioned there. If you will not understand, or if you have some confusion, just go to the other option. Just go to the other CPT code. So when you read out all the description for all the CPT codes, you will conclude in, the answer. That's how you can answer in examination. Okay, I'm just explaining you how to easily save time in the examination. Okay. So what does 27096, the description? The same as it is mentioned in the question, right? Injection procedure for sacroiliac joint. Steroid with image guidance. See, it is, this CPT code already includes the image guidance. So we don't have to code separately for the imaging guidance 77003 as mentioned in option D. Option A and D. Option A, anyway, it is incorrect. Option D. So that is in option D, the same CPT code along with imaging guidance is mentioned, which is not required because already 27096 includes the imaging guidance, including arthrography when performed. Okay. And then if you go down in brackets, so many, like almost in 3 brackets, it's written there. 27096 is to be used only with CT or fluoroscopic imaging confirmation of intra-articular needle positioning. Okay. Is there anything mentioned intra-articular in the question? Anyway, it is needle positioning mentioned. Now, if CT or fluoroscopy imaging is not performed, you have to use the code 20552. Again, in another bracket, it is mentioned. Code 27096 is a unilateral procedure. For bilateral procedure, use modifier 50. So, this is a unilateral code procedure. Okay. So, what is in our question? In our question, it is unilateral only. On the left sacroiliac joint, it is mentioned. This is not a bilateral. In our question also, they have not mentioned the procedure as bilateral. It is unilateral. It is performed only on the left sacroiliac joint. So, you have to, since it is a unilateral code, 27096 is a unilateral code, you have to append modifier whether it is left or right. This is left. So, you have to code append modifier LT for the left. So, you got the correct answer as option C. Okay. Now, there is one important guideline for this sacroiliac joint injection. Do not report a sacroiliac joint injection, the CPT code 27096, and a block of the nerves innervating the sacroiliac joint for the same side as per the policy, that is CPT 64451. 64451, you should not report the CPT codes 27096, which is sacroiliac joint injection, along with the CPT 64451, which is block of the nerves innervating sacroiliac joint. Do not report it in the, for the same side, you should not report the code. Okay. Let's move to the third question. A 46-year-old female had a previous biopsy that indicated positive margins anteriorly on the right side of her neck. A 0.5 centimeter margin was drawn out and a 15 blade scalpel was used for full excision of an 8 centimeter lesion. Light undermining of all margins was performed along with layered closure. The specimen was sent for permanent histopathologic examination. What are the codes for this procedure? So what are the procedures carried out here? What are the procedures carried out? Excision, right? This patient was having a previously biopsy done, okay, which shows positive margins. So 0.5 centimeter margin was drawn and 15 blade scalpel was used for full excision of 8 centimeter lesion. So here 8 centimeter lesion was excised and then the specimen was sent for histopathologic examination. Okay, let's move to the codes one by one. What is CPT 11426? Excision code. This is excision benign lesion including margins except skin tag, scalp, neck, hands, feet, genitalia. Which part is this? Right side of her neck. So here neck can be done. Excision benign lesion. Let's move to the other CPT code 11626. What is 11626? Excision malignant lesion. See, on the code 11426, it represents a benign lesion. 11626 represents a malignant lesion. Excision excised over 4 centimeter. Our excision is 8 centimeter. How will you know if it is a benign or malignant? That is what is mentioned in the first line. The patient was having previous biopsy that indicated positive margins. It means it's a malignant. If it is a positive margin, it means it is a malignant. So you have to code for the malignant code 11626. Okay. So what is option C? Anyway, we already got one CPT code 11626, which is there in options B and C, right? But in option C, there is one more code 12044. Let's check what is that code. 12044 is repair of intermediate wounds of neck, hand, feet, or external genitalia 7.6 centimeter to 12.5 centimeter. This is, same 8 centimeter. But what is this procedure? 12044. Repair of intermediate wound. See, in our question, in the third sentence, light undermining of all margins was performed along with layered closure. Layered closure means intermediate repair. Okay, it's another word for intermediate repair. If you can check the musculoskeletal chapter which I had taken in the beginning, I had mentioned there the other terms for simple, intermediate, complex, everything. Okay, so intermediate repair is layered closure. Layered closure means the intermediate repair. So in the third sentence, it is already mentioned that light undermining of all margins was performed. Means some repair was performed for all the margins. All margins of means our size is 8 centimeter along with layered closure. Along with layered closure means repair of intermediate wound. So that also you have to quote. So here multiple procedure has been carried out. So we have to append the modifier 51 to the second code. So instead of option B, you have to mark our answer as option C because both the procedures are being carried out. The excision as well as intermediate repair closure. Okay. So answer is option C. No need to go for option D because 11426 is the incorrect CPT code, not a correct one. Moving on to the fourth question. Ken suffered a severe crushing injury to his upper left leg. 2 days after the surgery, Dr. James completed a dressing change under general anesthesia. How will you report this service? How will you report this service means what is the service done here? The dressing change. The patient came to the doctor, Dr. James, for a complete dressing change under general anesthesia. So you have to code for the dressing change, right? Okay. Moving on to the codes one by one. What is the first one? 16020. 16020 represents dressings and or debridement of partial thickness burns, initial or subsequent. This is not a burn dressing. This is crushing injury to the upper leg. So you cannot quote that one. What is option B? 15852. What is the code for 15852? Dressing change for other than burns under anesthesia other than local. See how it is mentioned, the description for the code 15852. Dressing change other than burns. Yes. In our question, it is not burn. Under anesthesia other than local. Yes. In our question, it is not local, it is general anesthesia. So, you got the correct CPT code 15852, right? Dressing change under general anesthesia, which is not a burn dressing. So, this is the correct CPT code for this question 15852. And since it is the procedure has been carried out on the left leg, you have to append it with the modifier LT. LT, which is there in option D. So that will be our answer, because in option B, 2 more codes, anesthesia codes has been marked 0123, 01232, which is not required, because already in the CPT code 15852 that general anesthesia is coming. Anesthesia, it's already included the anesthesia, general anesthesia. So we don't have to code separately for anesthesia. Hence, our correct answer is option D, 15852 with modifier LT. Let's look into one more question. Fifth question. Mary, who had food allergies, came to her physician for her weekly allergen immune therapy. Allergen immune therapy, okay? That consists of 2 injections prepared and provided by the physician. The correct CPT code is. So here you have to code for the allergen immunotherapy. Allergen immunotherapy comes in the medicine, chapter medicine, starting 95 codes. Okay, let's look into the codes one by one. What is 95125? Professional services for allergen immunotherapy in the office or institution of the prescribing physician or other qualified healthcare professional, including provision of allergenic extract, 2 or more injections. So the code 95125 is 2 or more injections. Yes, in our question it is 2 injections. So you have to code that one. What is the second code? 95117. Professional services for allergen immunotherapy, not including provision of allergenic extracts, 2 or more injections. What is in our question? Including allergenic extract, because already it is mentioned in the question that the patient Mary was having food allergies. Okay, and she came to her physician for weekly allergen immunotherapy. It is provided by the same physician. So you have to code the first one, 95125. Professional services for allergen immunotherapy in the office or institution of the prescribing physician. The same physician has been carried out. For 2 or more injection, you have to code 95125. So the correct answer is option A, 95125. In option C and D, it is incorrect, because 95131 is stinging insect venoms. That is incorrect. And 95146 is also stinging insect venoms, which is incorrect. So friends, hope you like the video. If this video is found useful, please like and share, and please support me by subscribing to the channel. Let's see you in the next episode, in the upcoming episodes, with more and more questions. If you have any queries, please mark it in the comments. Thank you so much, friends. Bye. Take care.